Hi, everyone, and welcome to the latest installment of Ask Dr. Sharon. I'm Sharon Walt. I am a certified functional medicine health coach, and I'm here to answer questions about Hashimoto's in particular, or any question about autoimmune disorders in general. Okay, so today's question is something I get asked quite a bit, and it's, how often should I get my thyroid hormone blood test done? Okay, so the answer to that is, as usual, it depends. And in this particular case, it depends on why you're getting the test done. So usually we have the test done because we have made a change or done an intervention, something done to our health, and we want to see what the effect is on our thyroid function. Now, some of the common ones are, in particular, your doctor could be changing or adjusting your thyroid medication, and you want to see what the effect is. And in this particular case, you probably don't have to wait very, very long, because the effect of supplemental thyroid medication is going to be directly should be showing up directly. Now, there's other reasons why you might want to get the test done, and that's if you are doing another intervention. Let's say you are making some changes to your diet, you've started a gut dysbiosis protocol, or you've started a toxin elimination protocol. Now, in those particular cases, the effectiveness of those protocols can take a little bit of time before they show up and before they'll show up in a blood test. And this next point, it can be a little bit disappointing, but in many, or actually in most cases, there are more than one trigger to Hashimoto's. So any intervention you take may not have the big effect that you're looking for, because there are a number of different things that have to change. Okay, so I guess the one thing I'm trying to get through here is that you have to be a little bit patient. So how often your hormone levels need to be tested is going to depend a lot on the intervention and the effectiveness of the intervention. One thing that you probably should consider is tracking your symptoms. Now, whether you want to do this daily or do it weekly, that might be a better indication of what's working and what's not. Now, in particular, let's just mention a bit about thyroid antibodies. Now, even with a successful intervention, this may not show up in the antibodies for a while, because they will have a lifespan of about 6 months. So even if you've done a successful intervention and your body is no longer producing those antibodies, it's going to take about another 6 months before the natural die-off of the existing antibodies. Okay, so again, you do have to be a little bit patient about this. But one of the main things I wanted to talk about today was, when you get the blood test done, you want to ensure that they're going to be valid, they're actually going to be meaningful for you. And I'm going to talk about 2 things that you can do to ensure better reliability or better validity of the blood test. Now, the first one is making sure that you take your blood test, so that the blood draw is done at the same time every time that you have the test done. So you can compare, especially if you're going to compare it against a baseline, you need to take it at the very same time. Okay, why is that important? Well, because a lot of our hormones, a lot of our mineral levels, and a number of other things that we analyze in a blood test fluctuate. And it fluctuates throughout the day. So that means is that if you take a blood test and it's not taken at exactly the same time, and you see a change, you don't know whether that change is due to the intervention that you've just done, or whether it's because you've just taken it at a different time of day, when your hormone level is going to be at a different time, naturally at a different level. Okay, so taking it at the very same time every time you have the blood test done. Now, the second one is, most people know that any medications that you're taking can affect your blood test, what the readings of the blood test are. And your doctor will be able to tell you which ones can have an impact. But what is not generally known is that supplements can have the same effect. And in particular, with regards to thyroid testing, vitamin B7 or biotin can have an effect on the readings. Now, vitamin B7 and biotin are naturally in our food, so does that mean we have to stop eating? So, well, no, not at all. At those levels, it's not going to have that much of a difference. It's only when the levels go beyond about 30 micrograms daily that it's going to have an effect on the blood test. So if you're taking extra supplements, it could be multiple B vitamin or whatever, check to see what the dosage is on it. If it's more than 30 micrograms, then I highly suggest that you stop taking it for a couple of days before you have the blood test done. Okay, so time of day, and consider any supplement use in order to make sure that the blood tests are measuring what they're supposed to be measuring. Now, there are a number of other things that you can be doing. I don't have time to go into the entire list today, but what I will do is put a link in the comment section below to a blog article that I wrote a while back that goes into detail about all the different things that you can do prior to having the blood test done to ensure that you're getting some meaningful results. Okay, I hope that you found this really helpful. If you've got any comments or further questions about it, you can either comment below or message me. And if there's anyone out there who really wants to make a change to their health and you're not sure about what to do or how to go about doing it, then again, get in touch. We'll have a discussion. We'll get you sorted. Okay, everyone, I hope you enjoy the rest of your week and stay safe. All the best.